Question 1. A 58-year-old client with end-stage liver failure secondary to cirrhosis is admitted with increasing confusion, irritability, and difficulty performing simple calculations. The nurse notes hysterexis when the client extends both arms. Laboratory findings reveal elevated ammonia levels. Which nursing intervention should receive the highest priority? A. Restrict oral fluids to 1,000 milliliters per day. B. Administer prescribed lactulose and monitor bowel movements. C. Encourage increased protein intake at each meal. D. Place the client in Trendelenburg position. Answer. B. Administer prescribed lactulose and monitor bowel movements. Rationale. The client is demonstrating hepatic encephalopathy caused by ammonia accumulation. Lactulose reduces ammonia absorption by trapping ammonia in the colon and promoting excretion through stools. Treating encephalopathy is the priority because neurological deterioration can progress to coma. Question 2. A client with advanced liver failure develops ascites and is scheduled for a large volume paracentesis. Which assessment finding requires immediate notification of the healthcare provider following the procedure? A. Urine output of 40 milliliters per hour. B. Blood pressure of 84/50 millimeter of mercury. C. Mild abdominal tenderness. D. Weight loss of 2 kilograms. Answer. B. Blood pressure of 84/50 millimeter of mercury. Rationale. Large volume fluid removal can cause circulatory collapse and hypovolemia. Significant hypotension following paracentesis may indicate hemodynamic instability and requires immediate intervention. Question 3. A nurse is caring for a client with liver failure who suddenly vomits approximately 500 milliliters of bright red blood. Which action should the nurse take first? A. Obtain a stool specimen for occult blood. B. Place the client in a supine position. C. Activate emergency response and assess airway status. D. Administer oral fluids. Answer. C. Activate emergency response and assess airway status. Rationale. Massive hematemesis from esophageal varices is life-threatening. Airway protection and hemodynamic stabilization take priority over all other interventions. Question 4. A client with liver failure is receiving spironolactone for management of ascites. Which laboratory value is most important for the nurse to monitor? A. Hemoglobin. B. Potassium. C. Platelet count. D. Bilirubin. Answer. B. Potassium. Rationale. Spironolactone is a potassium-sparing diuretic. Hyperkalemia can develop and may cause dangerous cardiac dysrhythmias. Question 5. A client with liver failure becomes increasingly lethargic. Which assessment finding would most strongly suggest worsening hepatic encephalopathy? A. Decreased bilirubin level. B. Positive Babinski reflex. C. Fader hepaticus and inability to follow commands. D. Increased appetite. Answer. C. Fader hepaticus and inability to follow commands. Rationale. Progressive neurological impairment and characteristic musty breath odor indicate worsening hepatic encephalopathy, requiring immediate treatment. Question 6. The nurse is evaluating laboratory data for a client with severe liver failure. Which result is most concerning? A. Albumin 2.0 G/DL. B. 3.8 Indian rupees. C. AST 95 U/L. D. Alt 88 U/L. Answer. B. 3.8 Indian rupees. Rationale. A markedly elevated INR reflects impaired clotting factor synthesis and places the client at high risk for life-threatening bleeding. Question 7. A client with cirrhosis develops tense ascites and shortness of breath. Which explanation best describes the cause of the respiratory difficulty? A. Increased erythropoietin production. B. Compression of the diaphragm by abdominal fluid. C. Excessive oxygen consumption by the liver. D. Hypercalcemia-induced muscle weakness. Answer. B. Compression of the diaphragm by abdominal fluid. Rationale. Massive ascites elevates the diaphragm, reducing lung expansion and causing dyspnea. Question 8. A client with liver failure has platelet count of 48,000/mm superscript 3. Which nursing intervention is most appropriate? A. Use intramuscular injections when possible. B. Assess for signs of bleeding every shift. C. Encourage vigorous toothbrushing. D. Place the client on unrestricted activity. Answer. B. Assess for signs of bleeding every shift. Rationale. Severe thrombocytopenia significantly increases bleeding risk. Frequent monitoring for bleeding is essential. Question 9. A client with chronic liver failure asks why albumin infusions are prescribed. Which response by the nurse is most accurate? A. Albumin lowers ammonia levels. B. Albumin replaces clotting factors. C. Albumin helps draw fluid back into the vascular space. D. Albumin destroys bilirubin. Answer. C. Albumin helps draw fluid back into the vascular space. Rationale. Albumin increases oncotic pressure, helping reduce edema and ascites by moving fluid into circulation. Question 10. A client with liver failure is admitted with confusion. The nurse reviews the following findings. Ammonia, 145 micrograms per deciliter. Sodium, 138 milliequivalent/L. Potassium, 4.2 milliequivalent/L. Glucose, 102 milligrams per deciliter. Which finding most likely explains the neurological symptoms? A. Sodium level. B. Potassium level. C. Ammonia level. D. Glucose level. Answer. C. Ammonia level. Rationale. Elevated ammonia is a major contributor to hepatic encephalopathy and altered mental status in liver failure. Question 11. A 52-year-old client with decompensated cirrhosis is admitted to the intensive care unit with worsening hepatic encephalopathy. During morning assessment, the nurse notes the following. Ammonia, 182 micrograms per deciliter. Glasgow Coma Scale, 10. Respiratory rate, 10 per minute. Oxygen saturation, 93% on room air. Increasing somnolence. Which action should the nurse take first? A. Administer prescribed lactulose. B. Request a dietary consultation. C. Assess the client's ability to protect the airway. D. Obtain daily weight. Answer. C. Assess the client's ability to protect the airway. Rationale. The client's declining neurological status places airway protection at immediate risk. Airway, breathing, and circulation always take priority. Aspiration and respiratory compromise are major causes of deterioration in severe hepatic encephalopathy. Question 12. A client with hepatic encephalopathy receives the following prescriptions. Which prescription should the nurse question? A. Lactulose 30 milliliters every 6 hours. B. Rifaximin 550 milligrams twice daily. C. Discontinue all dietary protein until ammonia level normalizes. D. Monitor neurological status every 4 hours. Answer. C. Discontinue all dietary protein until ammonia level normalizes. Rationale. Routine protein elimination is not recommended because it promotes malnutrition and poor outcomes. Question 13. A client with liver failure is admitted for upper gastrointestinal bleeding from esophageal varices. Which assessment finding indicates the client is experiencing hypovolemic shock? A. Blood pressure 82/46 mm of mercury and heart rate 132 per minute. B. Temperature 99 degrees Fahrenheit 37.2 degrees Celsius. C. Oxygen saturation 97% on 2L oxygen. D. Bilirubin 4.2 milligrams per deciliter. Answer. A. Blood pressure 82/46 mm of mercury and heart rate 132 per minute. Rationale. Hypotension accompanied by tachycardia strongly suggests shock from acute blood loss and requires immediate intervention. Question 14. A nurse is caring for a client with advanced liver failure. Which finding requires immediate intervention? A. Albumin 2.8 g/dl. B. Mild jaundice of the sclera. C. New onset confusion and inability to identify family members. D. Abdominal girth increased by 2 centimeters. Answer. C. New onset confusion and inability to identify family members. Rationale. Acute mental status changes may indicate worsening hepatic encephalopathy and progression toward coma. Question 15. A client with severe cirrhosis develops spontaneous bacterial peritonitis. Which assessment finding most strongly supports this diagnosis? A. Bradycardia and hypertension. B. Fever, abdominal pain, and worsening ascites. C. Polyuria and polydipsia. D. Bilateral calf tenderness. Answer. B. Fever, abdominal pain, and worsening ascites. Rationale. Spontaneous bacterial peritonitis commonly presents with fever, abdominal tenderness, worsening ascites, and signs of systemic infection. Question 16. A nurse receives report on 4 clients. Which client should be assessed first? A. Client with cirrhosis reporting fatigue and anorexia. B. Client with ascites awaiting scheduled paracentesis. C. Client with liver failure who is increasingly difficult to arouse. D. Client with jaundice requesting pain medication. Answer. C. Client with liver failure who is increasingly difficult to arouse. Rationale. Decreasing level of consciousness suggests progression of hepatic encephalopathy and possible impending coma, making this the highest priority. Question 17. A client with end-stage liver disease has the following laboratory values. Sodium, 124 milliequivalent/L. Potassium, 4.0 milliequivalent/L. Ammonia, 68 micrograms per deciliter. Albumin, 2.3 g/dl. Which finding requires the most immediate nursing attention? A. Sodium 124 milliequivalent/L. B. Potassium 4.0 milliequivalent/L. C. Ammonia 68 micrograms per deciliter. D. Albumin 2.3 g/dl. Answer. A. Sodium 124 milliequivalent/L. Rationale. Severe hyponatremia can cause seizures, cerebral edema, and neurological deterioration. It requires prompt evaluation and management. Question 18. A client with advanced liver failure has received lactulose for hepatic encephalopathy. 4 hours later, the nurse obtains the following data. Alert and oriented times 3. 2 soft bowel movements. Ammonia decreased from 150 to 92 micrograms per deciliter. Asterixis improved. Which findings indicate the treatment has been effective? Select all that apply. A. Alert and oriented times 3. B. 2 soft bowel movements. C. Ammonia decreased from 150 to 92 micrograms per deciliter. D. Improved asterixis. E. Presence of jaundice. Answer. A. Alert and oriented times 3. B. 2 soft bowel movements. C. Ammonia decreased from 150 to 92 micrograms per deciliter. D. Improved asterixis. Rationale. Improved neurological status, decreased ammonia levels, and appropriate bowel elimination indicate effective lactulose therapy. Jaundice does not evaluate encephalopathy treatment effectiveness. Question 19. A client with severe liver failure develops hepatorenal syndrome. Which assessment finding should the nurse anticipate? A. Increased urine output and low creatinine. B. Oliguria and rising serum creatinine. C. Polyuria with dilute urine. D. Glycosuria and ketonuria. Answer. B. Oliguria and rising serum creatinine. Rationale. Hepatorenal syndrome is characterized by progressive renal failure resulting in decreased urine output and elevated creatinine despite structurally normal kidneys. Question 20. A nurse is reviewing assessment findings for a client admitted with acute on chronic liver failure. Which finding requires immediate provider notification? A. Total bilirubin 9 milligrams per deciliter. B. Mild peripheral edema. C. INR increased from 2.1 yesterday to 5.2 today. D. Decreased appetite. Answer. C. INR increased from 2.1 yesterday to 5.2 today. Rationale. A rapidly rising INR indicates severe deterioration of hepatic synthetic function and an extremely high risk for spontaneous, potentially fatal bleeding. Immediate evaluation is required. Question 21. A 60-year-old client with decompensated cirrhosis is admitted to the ICU after massive esophageal variceal hemorrhage. During assessment, the nurse notes: blood pressure, 78/42 millimeter of mercury. Heart rate, 138 per minute. Respiratory rate, 30 per minute. Oxygen saturation, 89% on 4L nasal cannula. Client is vomiting bright red blood. Which action should the nurse take first? A. Obtain a hemoglobin level. B. Prepare for emergency endoscopy. C. Apply oxygen and assess airway patency. D. Administer lactulose. Answer. C. Apply oxygen and assess airway patency. Rationale. Massive upper GI bleeding places the client at immediate risk for aspiration and respiratory failure. Airway and oxygenation take priority before diagnostic or definitive interventions. Question 22. A client with advanced liver failure develops worsening ascites despite maximal diuretic therapy. The nurse notes increasing abdominal distension, respiratory distress, and oxygen saturation of 91%. Which provider prescription should the nurse anticipate? A. Immediate insulin infusion. B. Large volume paracentesis. C. Hemodialysis. D. Continuous bladder irrigation. Answer. B. Large volume paracentesis. Rationale. Severe refractory ascites causing respiratory compromise is commonly treated with therapeutic paracentesis to relieve pressure and improve ventilation. Question 23. A nurse is caring for a client with acute liver failure. Which assessment finding suggests cerebral edema, a life-threatening complication? A. Bradycardia, hypertension, and declining level of consciousness. B. Polyuria and thirst. C. Mild jaundice and fatigue. D. Peripheral edema and ascites. Answer. A. Bradycardia, hypertension, and declining level of consciousness. Rationale. These findings may indicate increased intracranial pressure associated with cerebral edema, a major cause of mortality in acute liver failure. Question 24. A client with end-stage liver disease receives albumin following removal of 7 liters of acidic fluid. What is the primary purpose of albumin administration? A. Prevent hepatic encephalopathy. B. Prevent circulatory collapse and maintain intravascular volume. C. Increase bile production. D. Lower bilirubin levels. Answer. B. Prevent circulatory collapse and maintain intravascular volume. Rationale. Large volume fluid removal can result in significant intravascular volume depletion. Albumin helps maintain oncotic pressure and circulatory stability. Question 25. A client awaiting liver transplantation becomes increasingly restless and confused. The nurse reviews the following data. Ammonia, 165 micrograms per deciliter. Sodium, 132 milliequivalent/L. Potassium, 4.1 milliequivalent/L. Glucose, 110 milligrams per deciliter. Which finding is the most likely cause of the client's symptoms? A. Sodium 132 milliequivalent/L. B. Potassium 4.1 milliequivalent/L. C. Glucose 110 milligrams per deciliter. D. Ammonia 165 micrograms per deciliter. Answer. D. Ammonia 165 micrograms per deciliter. Rationale. Severe hyperammonemia is strongly associated with worsening hepatic encephalopathy and altered mental status. Question 26. A nurse is monitoring a client with liver failure receiving lactulose every 4 hours. Which finding indicates the medication may need adjustment? A. 3 soft stools daily. B. Improved orientation. C. 8 watery stools during the shift. D. Reduced hysterexis. Answer. C. 8 watery stools during the shift. Rationale. Excessive diarrhea can lead to dehydration, electrolyte disturbances, and worsening clinical instability. The dosage may require adjustment. Question 27. A client with liver failure develops hepatorenal syndrome. Which assessment finding should the nurse report immediately? A. Urine output of 12 milliliters per hour for the past 4 hours. B. Mild ankle edema. C. Total bilirubin of 5 milligrams per deciliter. D. Decreased appetite. Answer. A. Urine output of 12 milliliters per hour for the past 4 hours. Rationale. Marked oliguria indicates worsening renal perfusion and progression of hepatorenal syndrome requiring urgent intervention. Question 28. A client with liver failure is admitted for suspected spontaneous bacterial peritonitis. Assessment findings include temperature, 101.8 degrees Fahrenheit, 38.8 degrees Celsius. Heart rate, 118 per minute. Abdominal pain. Increasing ascites. White blood cell count, 17,000/mm superscript 3. Which findings support the diagnosis? Select all that apply. A. Fever. B. Tachycardia. C. Abdominal pain. D. Increasing ascites. E. Elevated white blood cell count. Answer: A. Fever. B. Tachycardia. C. Abdominal pain. D. Increasing ascites. E. Elevated white blood cell count. Rationale: all findings are consistent with spontaneous bacterial peritonitis and indicate an infectious process requiring rapid treatment. Question 29. A nurse receives laboratory results for a client with severe liver failure. Hemoglobin 7.1 g/dl. Platelets 38,000/mm superscript 3. INR 4.8. Ammonia 92 micrograms per deciliter. Which finding presents the greatest immediate risk? A. Hemoglobin 7.1 g/dl. B. Platelets 38,000/mm superscript 3. C. 4.8 Indian rupees. D. Combined severe coagulopathy and thrombocytopenia. Answer: D. Combined severe coagulopathy and thrombocytopenia. Rationale: the combination of profoundly impaired clotting factor production and severe thrombocytopenia places the client at extremely high risk for catastrophic bleeding. Question 30. The nurse receives report on 4 clients with liver disease. Which client should be assessed first? A. Client with ascites reporting abdominal discomfort rated 4 out of 10. B. Client with cirrhosis whose ammonia level decreased from 110 to 70 micrograms per deciliter. C. Client with liver failure who suddenly becomes difficult to arouse and has new-onset hysterexis. D. Client with jaundice awaiting discharge instructions. Answer: C. Client with liver failure who suddenly becomes difficult to arouse and has new-onset hysterexis. Rationale: acute neurological deterioration suggests worsening hepatic encephalopathy and possible progression toward coma. This client has the highest priority for immediate assessment and intervention. Question 31. A 49-year-old client with acute on chronic liver failure is admitted to the ICU. During the shift, the nurse notes: blood pressure 88/54 millimeter of mercury, heart rate 124 per minute, urine output 15 milliliters per hour, lactate 5.2 millimoles per liter. Increasing confusion. Which finding most strongly suggests the client is progressing toward multi-organ failure? A. Heart rate of 124 per minute. B. Urine output of 15 milliliters per hour and elevated lactate level. C. Blood pressure of 88/54 millimeter of mercury only. D. Increasing confusion alone. Answer: B. Urine output of 15 milliliters per hour and elevated lactate level. Rationale: evidence of poor tissue perfusion and renal dysfunction suggests developing multi-organ failure. Elevated lactate reflects inadequate oxygen delivery at the cellular level. Question 32. A client with severe liver failure develops increasing abdominal distension. The nurse obtains the following assessment findings. Respiratory rate, 32 per minute. Oxygen saturation, 90%. Difficulty speaking in complete sentences. Marked abdominal tension. Which intervention should the nurse anticipate first? A. Incentive spirometry every hour. B. Therapeutic paracentesis. C. Oral fluid challenge. D. Ambulation in the hallway. Answer: B. Therapeutic paracentesis. Rationale: massive ascites can impair ventilation by elevating the diaphragm. Therapeutic paracentesis may relieve respiratory compromise. Question 33. A client with fulminant liver failure develops severe hypoglycemia. Which explanation best accounts for this finding? A. Increased pancreatic insulin secretion. B. Impaired hepatic glycogen storage and glucose production. C. Excess thyroid hormone release. D. Renal glucose wasting. Answer: B. Impaired hepatic glycogen storage and glucose production. Rationale: the liver is responsible for glycogen storage and gluconeogenesis. Liver failure can result in profound hypoglycemia due to impaired glucose regulation. Question 34. A client awaiting liver transplantation suddenly develops hematemesis. Which provider prescription should the nurse implement first? A. Administer prescribed vasoactive medication and establish large bore for access. B. Obtain a dietary history. C. Encourage oral fluids. D. Place the client in Trendelenburg position. Answer. A. Administer prescribed vasoactive medication and establish large bore for access. Rationale. Variceal hemorrhage is a medical emergency. Rapid vascular access and medications to reduce portal pressure are critical priorities. Question 35. A nurse is evaluating laboratory values in a client with end-stage liver disease. Which value requires immediate follow-up? A. Albumin 2.5 g/dl. B. Bilirubin 8.4 mg per deciliter. C. Ammonia 210 micrograms per deciliter. D. AST 120 U/L. Answer. C. Ammonia 210 micrograms per deciliter. Rationale. Severely elevated ammonia levels place the client at high risk for worsening hepatic encephalopathy, cerebral edema, and coma. Question 36. A client with cirrhosis is receiving spironolactone and furosemide for ascites management. Which assessment finding should the nurse report immediately? A. Weight loss of 0.5 kilograms in 24 hours. B. Potassium level of 6.2 milliequivalent/L. C. Mild decrease in edema. D. Urine output of 50 milliliters per hour. Answer. B. Potassium level of 6.2 milliequivalent/L. Rationale. Severe hyperkalemia can cause fatal cardiac dysrhythmias and requires immediate intervention. Question 37. A client with advanced liver failure is receiving treatment for hepatic encephalopathy. The nurse reviews the following data. Ammonia decreased from 170 to 85 micrograms per deciliter. Client follows commands appropriately. Asterixis resolved. Glasgow Coma Scale increased from 11 to 15. Which findings indicate improvement? Select all that apply. A. Ammonia decreased from 170 to 85 micrograms per deciliter. B. Client follows commands appropriately. C. Resolution of asterixis. D. Glasgow Coma Scale increased from 11 to 15. E. Presence of jaundice. Answer. A. Ammonia decreased from 170 to 85 micrograms per deciliter. B. Client follows commands appropriately. C. Resolution of asterixis. D. Glasgow Coma Scale increased from 11 to 15. Rationale. All of these findings demonstrate neurological improvement and effective management of hepatic encephalopathy. Jaundice may persist despite clinical improvement. Question 38. A client with severe liver failure develops spontaneous bleeding from venipuncture sites. Which laboratory result best explains this finding? A. Albumin 2.1 g/dl. B. 5.6 Indian rupees. C. Bilirubin 6.8 milligrams per deciliter. D. Sodium 130 milliequivalent/L. Answer. B. 5.6 Indian rupees. Rationale. A markedly elevated INR indicates severe impairment of clotting factor synthesis and a high risk for spontaneous bleeding. Question 39. A nurse is caring for a client being evaluated for liver transplantation. Which assessment finding is most concerning and requires immediate intervention? A. Mild jaundice. B. Pruritus. C. New onset confusion with inability to maintain airway protection. D. Fatigue after ambulation. Answer. C. New onset confusion with inability to maintain airway protection. Rationale. Loss of airway protective reflexes indicates severe hepatic encephalopathy and may necessitate advanced airway management. Question 40. The nurse receives report on 4 clients. Which client should be assessed first? A. Client with cirrhosis who reports increasing abdominal fullness from ascites. B. Client with chronic liver disease whose platelet count is 75,000/mm superscript 3. C. Client with liver failure who suddenly develops unequal pupils and decreasing responsiveness. D. Client with jaundice requesting assistance with hygiene. Answer. C. Client with liver failure who suddenly develops unequal pupils and decreasing responsiveness. Rationale. Unequal pupils and declining responsiveness suggest possible cerebral edema and increased intracranial pressure, a life-threatening complication requiring immediate assessment and intervention. Question 41. A 46-year-old client with fulminant liver failure is admitted to the ICU. During assessment, the nurse notes, Glasgow Coma Scale, 8. Blood pressure, 96/58 millimeter of mercury. Heart rate, 118 per minute. Ammonia, 225 micrograms per deciliter. Increasing agitation followed by somnolence. Which action should the nurse take first? A. Administer prescribed lactulose. B. Assess and secure the client's airway. C. Obtain a daily weight. D. Restrict sodium intake. Answer. B. Assess and secure the client's airway. Rationale. A Glasgow Coma scale of 8 indicates a high risk for loss of airway protective reflexes. Airway management takes priority before other interventions. Question 42. A client with acute liver failure develops cerebral edema. Which assessment finding should the nurse expect? A. Improved level of consciousness. B. Bradycardia, hypertension, and decreased responsiveness. C. Polyuria and dry mucous membranes. D. Tachycardia and hyperactive bowel sounds. Answer. B. Bradycardia, hypertension, and decreased responsiveness. Rationale. These findings are consistent with increased intracranial pressure, a serious complication of acute liver failure. Question 43. A client with end-stage liver disease develops disseminated intravascular coagulation, DIC. Which assessment finding requires immediate intervention? A. Small ecchymosis on the arm. B. Oozing blood from foresights and decreasing blood pressure. C. Mild fatigue after activity. D. Bilateral ankle edema. Answer. B. Oozing blood from foresights and decreasing blood pressure. Rationale. DIC can cause widespread bleeding and circulatory collapse. Active bleeding with hemodynamic instability is an emergency. Question 44. A nurse is caring for a client with severe liver failure. Which finding is most indicative of worsening hepatorenal syndrome? A. Urine output 10 milliliters per hour and rising creatinine level. B. Mild peripheral edema. C. Bilirubin 7 milligrams per deciliter. D. Weight gain of 0.5 kilograms. Answer. A. Urine output 10 milliliters per hour and rising creatinine level. Rationale. Progressive renal dysfunction is the hallmark of hepatorenal syndrome and significantly worsens prognosis. Question 45. A client with advanced cirrhosis develops sudden hematemesis and melena. The nurse notes. BP 76/40 millimeter of mercury. HR 142 per minute. Cool, clammy skin. Altered mental status. Which complication is the client most likely experiencing? A. Hepatic encephalopathy only. B. Septic shock. C. Hypovolemic shock secondary to variceal bleeding. D. Acute pancreatitis. Answer. C. Hypovolemic shock secondary to variceal bleeding. Rationale. Massive gastrointestinal blood loss can rapidly cause circulatory collapse and shock. Question 46. A client being evaluated for liver transplantation has the following findings. 5.1 Indian rupees. Bilirubin 18 milligrams per deciliter. Ammonia 160 micrograms per deciliter. New confusion. Which finding should the nurse recognize as the strongest indicator of declining liver function? A. Elevated bilirubin. B. Elevated ammonia. C. New confusion. D. 5.1 Indian rupees. Answer. D. 5.1 Indian rupees. Rationale. The liver synthesizes clotting factors. A markedly elevated INR reflects severe loss of hepatic synthetic function and is a key marker of liver failure severity. Question 47. A client with acute liver failure is being monitored for cerebral edema. Which findings require immediate provider notification? Select all that apply. A. New onset unequal pupils. B. Glasgow Coma scale decrease from 14 to 10. C. Increasing systolic blood pressure with bradycardia. D. Improved orientation. E. Repeated vomiting. Answer. A. New onset unequal pupils. B. Glasgow Coma scale decrease from 14 to 10. C. Increasing systolic blood pressure with bradycardia. E. Repeated vomiting. Rationale. These findings suggest increasing intracranial pressure and possible cerebral edema, requiring urgent intervention. Question 48. A client with severe hepatic encephalopathy is receiving lactulose therapy. Which outcome best demonstrates treatment effectiveness? A. One-form stool every 3 days. B. Increased serum ammonia level. C. Improved cognition and reduced hysterexis. D. Increased abdominal girth. Answer. C. Improved cognition and reduced hysterexis. Rationale. The goal of therapy is reduction of ammonia-related neurological symptoms and improvement in mental status. Question 49. A nurse receives report on 4 ICU clients. Which client should be assessed first? A. Client with cirrhosis whose ammonia level is 95 micrograms per deciliter and stable. B. Client with ascites awaiting scheduled paracentesis. C. Client with liver failure who has active bleeding from 4 sites and an INR of 6.0. D. Client with jaundice reporting pruritus. Answer. C. Client with liver failure who has active bleeding from 4 sites and an INR of 6.0. Rationale. Active bleeding combined with severe coagulopathy places the client at immediate risk for life-threatening hemorrhage. Question 50. Priority NGN scenario. A client with end-stage liver failure experiences the following changes over a 4-hour period. Increasing confusion. Ammonia rises from 110 to 190 micrograms per deciliter. Urine output decreases from 40 milliliters per hour to 12 milliliters per hour. INR rises from 3.2 to 5.0. Blood pressure falls from 102/64 mmHg to 84/50 millimeter of mercury. Which clinical interpretation by the nurse is most accurate? A. The client is demonstrating expected progression of chronic disease without urgent concern. B. The client is showing signs of multi-organ deterioration requiring immediate escalation of care. C. The findings indicate effective treatment of hepatic encephalopathy. D. The client is stable but requires routine reassessment in 8 hours. Answer. B. The client is showing signs of multi-organ deterioration requiring immediate escalation of care. Rationale. Worsening encephalopathy, declining renal function, increasing coagulopathy, and hypotension collectively indicate severe clinical deterioration and impending multi-organ failure. Immediate provider notification and critical intervention are required. Thank you for joining me for 50 most confusing liver failure cases, the most failed NCLEX topic. If these questions helped strengthen your clinical judgment, make sure to like the video, subscribe to MCQs Master 101, and turn on notifications so you never miss future NCLEX reviews. Remember, elevated ammonia equals think hepatic encephalopathy. INR reflects liver synthetic function and bleeding risk. Variceal bleeding is a life-threatening emergency. Hepatorenal syndrome presents with oliguria and rising creatinine. Cerebral edema is a deadly complication of acute liver failure. Always prioritize airway, neurological status, bleeding, and perfusion. The NCLEX is not testing memorization alone. It is testing your ability to recognize the sickest patient and act safely under pressure. Comment below, which liver failure question challenged you the most? Keep practicing, keep learning, and keep thinking like a nurse. Until next time, stay focused, stay confident, and keep mastering NCLEX one question at a time. MCQs Master 101, where future nurses become NCLEX ready.